Guys, hello and welcome to the Librarian TV network. Today we are right here at Enfield, where in the National Health Institute of Liberia is addressing the press with regards to critical national issues on the monopox issue. Keep posted. I'm Francis Kedi Kopo. You can like, share, and comment on Facebook and YouTube channel.
So we invite here today the Director General will inform the people like Liberia through you about some training, public health issues and events. And so what shall do and not turn the floor over to the Director General, the President.
Good afternoon, everyone, and thank you for responding to this urgent and impromptu press conference. This is not the first time that we've done this. When the World Health Organization and the Africa CDC first announced this outbreak as issue of continental concern and global security, we then sprung to our feet as a public health entity in August when I took over in order to begin responding. When we had our first two cases, we then called a press conference, and it was the same way on a Sunday, a weekend, when we had that press conference. I will first and foremost want to say thanks to the DRDE. Dr. Jito is not here, Berta is here present, the Deputy Director, and the Division of Diagnostics, Public Diagnostics here at Enfield for such combined, tremendous and rapid work in responding. Adding to that thank is the Ministry of Health, where we have then the county health officers and the county health teams that also then collaborate based on the structures that we have in this public health response. We just came from the lab and we were on this case, the particular celebrated case, if I can put it that way, for the last almost 36 hours now. We have a procedure called a 717 where we intend to handle, receive the information, let's just say address it within 7 days. We shouldn't go beyond that. We are able to address this situation just within 72 hours, less than 72 hours. And so we want to be thankful. That's why we are thankful to all the forces that combine, and this level of cooperation and collaboration is needed. Thanks also to the press for on and off we have been educating each other on what an active case is, what a suspected case is, and we got to grasp those things. And for a very long period, as you will note, there was no misinformation circulating because the president actually grasped what these terminologies were, which were previously then misapplied. So thank you very much in that respect. In this particular situation, with this recent internet circulation of a suspected case and self-proclaimed, which we already hailed, and I will come to that. Again, the press has been very, very, very professional again in dealing with us as a public health medical institution. You didn't go out publishing stuff, you waited. We saw all your calls, we saw all your text messages, and we kept telling you we are addressing it. We are addressing it. Because for us, we address situation based on facts and the evidence. The evidence has to be scientific, and that's what we base on. If we say something is this, we must be able to prove it. And we will not just answer you as you've been relating to us over time. What triggered this press conference particularly is, again, this recent case. For a long time, the Enfield has been responding to the outbreak, which you can attest to. We came from like 1 case, 2 cases, 3, 7, and then we went all the way up to 63 around December. And then we got 7 cases, then it was 70. In the course of time, all of those cases recovered. And in December, just shortly before December, we had a period where we had no case. We had 0 cases in the country. Then after December, we started picking up cases again. We had about 7 cases, also 3 to 4 cases. Again, those cases were properly managed, again, given the kind of collaboration and the way our management system is. We then went to 0 in March. In March, we had 0 cases. Then we started picking up cases again. So to this date, from January 1st, 2024 to May 11, 2025, we have had, and please be careful with these numbers as you've always done, we've had 652 suspected cases, meaning all the cases that we do, we see that maybe on the skin, from the temperature, from all other symptoms, we say, maybe this person has something that that is circulating around. That's just a suspicion. So we bring that in, we take the samples from that person, and we test them in a lab. So what we receive in the lab, we receive about 572 of those samples in the lab, because not every case you take samples from. So, out of the 572 cases that we tested in the lab, we had a 100% testing rate, because that's why we brought in the lab, and that's why we tested. So we brought 572 of those samples of those cases in the lab. Then we tested all 572 of them, giving us a 100% testing rate, meaning before we were like 75%, due to some issues we had, chemicals, what we call reagents. So we were at 75, we were at 85. Then we started improving, thanks to the Africa CDC, the WHO, and the US CDC, and all other partners that have helped in this regard. All thanks goes to the Liberian government also, which for the first time, and among African governments, from our advocacy and other things, from the work we were doing, that has been one of the first governments to put a line item in the budget. And this effort came from, was enhanced by the advocacy of the Health Committee Chair in the Senate, Madam Vapila, and the Health Committee Chair in the House of Representatives, Madam Julie Weah. So we want to give them thanks also. Now, of those 572 that we tested, we got to confirm 78 to this date. So 78 confirmed cases. Okay, as you know, we said that that's the previous 70, 63, 65, right? And then they start adding on. So all of that is that total to this date. To this date that I'm saying, May 11, because we are at May 18 today. So the other bulletin will come up next week, which will then inform us as to other cases. So out of these 78 cases, we only have 1 active, right? So 77 recovered. So to this date, Liberia, to this date, this May 11, has only 1 active case. Now, interestingly and gloriously, from the work that we've done in combination, we have 0 deaths. So Liberia has no deaths. The concern comes when we have cases coming out of countries that we are bordering, and in the region also. Some time ago, for those of you who did not attend one of our NEPRC meetings, we did a comprehensive comparison with Liberia, South Africa, Sudan, DRC, of course, Congo, where we have most of these cases in Central Africa, and Sierra Leone at that time. At that time, Sierra Leone had only just 1 death. Now, if we do the comparison, we have total suspected cases of 652. For the Sierra Leonean bulletin that they put out on the 17th, again, we had our on the 11th. So they are 6 days ahead, right? Our next bulletin is coming up. And you can still compare that with these numbers we're giving you. We just did a comparison last week when we compared them head to head in our NEPRC meeting. There have total cases of 2,559 to this date. And we gave you this slide for your accurate records. We have total confirmed of 78, right? And they have total active cases, total new cases of 130. We have one active case, as we said, right? All of our cases have recovered. And we have one active case up to May 11. And our neighboring country has total active cases at this point of 1,918. And we gave you this so that you had that for your records. We have 0 deaths. Our immediate neighboring country has 13 deaths up to May 17. For us, up to May 11. And certainly we have been following throughout this week. We also have not heard of any death. There have been no deaths reported to us. So we can confidently say this figure remains at that until whatever may change. We have been communicating with the National Public Health Agency in Sierra Leone because of the pattern of transmission also, one of which we call cross-border transmission. We know what happened in our region during Ebola. We know what happened during COVID, but Ebola particularly, when the 3 countries, Guinea, Liberia, and Sierra Leone, were heavily infected. So from that point on, we've had very serious collaboration among ourselves. We, from the National Public Health Institute of Liberia, has been proactively engaging our neighbors. During the course of time, we have visited the Sierra Leonean border, the border with Sierra Leone, at Bo, waterside. We have visited other border points in Ganta as well, along on the Guinean side. We have done a cross-border. We have gone into the Ivory Coast, a program sponsored by WAHO, which is the West Africa Health Organization. And we did some exchange of information regarding how we are treating our cases here, how we are handling our cases, how we are going after them, how we are finding them, sharing our experience with our Ivorian brothers and sisters in the public health and medical arena. So we've been doing this. From the south, the WAHO, which is linked with WHO, there is an effort to also have another cross-border exercise of this with Guinea and Sierra Leone. That is coming up. Until we saw this import situation spiraling almost out of control in Sierra Leone, our neighboring country. So that is the level at which we are cooperating with our neighbors. The director of diagnostics just came in. We did say thank you very much for the sleepless nights. I left him at the lab and I came ahead because of, everyone else was waiting. So that's where we are. What we have done also in collaboration with the WHO, the Africa CDC, US CDC, is to continue increasing and enhancing our surveillance. Because we have to keep looking. Not only looking, but we have to keep testing also.